Kia ora. I want to point out a few things that people sometimes do when they're doing a pelvic floor muscle contraction that isn't quite correct. So the first thing is, when you do that nice squeezing and lifting of your pelvic floor up and side, there shouldn't be any squeezing of your buttock muscles. So if these muscles are tightening, you'll get a lifting up off the chair. Or if you were lying down, you might see the hips and pelvis lifting up a little bit. You also don't want tilting of the pelvis backwards, so you don't want a flattening out of the lower back. You don't want a strong sucking in of the breath, so we do want to have a little bit of a drawing in of the lower abdominals, but not a chest movement and a breath hold. The other thing we don't want is a bracing of the abdominals, so you don't want this pushing here, because when you push and brace your abs here, you tend to get a bearing down or a pushing down on your pelvic floor, which is the opposite of what we're looking for. So in people with a penis who are doing pelvic floor exercises, the focus needs to be at the front. So there will be a gentle drawing in and tightening around the anal sphincter muscles, so they'll feel a little bit of a movement around the anus, but that shouldn't be the focus. They should be really trying to work at the front. And if they can't feel that, sometimes it helps to lean forward a little bit and do it in this position. They might sort of be able to feel the sensation of what's going on a little bit more in that position.